Colleagues, it's my real pleasure to be with you today. This is UNEG. This is really at the heart of UNEG, exchanging practices, trying to promote innovation, sharing our knowledge, sharing what we know, what we have learned in the field, and strengthening our ability to address people's needs to the people that we serve, according to our respective agencies and mandates. And therefore, I'm really delighted to welcome you to this webinar. And without much further ado, I do look forward to this exciting exchange of experiences led by our colleagues in UNICEF. Back to you, Michele.
Thank you so much, Oscar. As Oscar said, colleagues, and thanks so much for joining us today. This is very much at the heart of what the United Nations do, what UNEG does, and we as evaluators, should be doing. Of course, the experience and the experiences that I will be sharing with you today, very much drawn from the UNICEF experience, from our own experience. So I'm basically presenting about stuff, as we could say in a very colloquial manner, that we have done ourselves, but we also have a venture out of our comfort zone, and we've been talking to NGO colleagues, some other UN agencies, etc. So if you have some additional experiences that you would like to share, some additional tools on top of what we're presenting today, please feel free, during the question and answers to intervene. And also, because we are creating a repository of materials and key resources for doing better evaluation with the children and young people, do not hesitate to share these resources with the UNEG Secretariat or with us directly, so that then we can make it available to everybody else. My name is Michele Tarsila. I'm the Regional Evaluation Advisor for UNICEF, based in Dakar, as I overview the 24 countries in West and Central Africa. And I'm glad to see there are many colleagues and friends, and hopefully new colleagues and new friends who are here with us today. So I guess that, before we go into the strictly methodological aspects of why we should be engaging with children and young people in evaluation, I would love to clarify why we should be doing this. And the reason why we should clarify a little bit the purpose and the rationale for engaging more with children and youth and young people is that sometimes we have to convince other colleagues that this is something good to do. We need to convince donors, we need to convince our bosses, the senior management, that some time and why not investments should be made for this specific way of doing evaluation. So hopefully some of the arguments that I'm going to present in this very first part of the presentation will give you some interesting information and thesis, basically, but that you will be able to defend whenever you want to introduce this kind of work in your day-to-day practice. So the first reason for talking about engagement with the youth and young people and children in evaluation is very simple. Some people say that working with children in evaluation is cute. I've heard the word cute quite a few times. And they said, some people that met me, they congratulated us for the work that we were doing because it was cute. But at the same time, they said it's important. So that cute to me is not enough. But we're not here to do cute things. So we're basically here to fulfill the rights that already exist. And, because I work in the Western Central Africa region, of course, I make reference to a very local or regional document, normative document, the African Charter on the Rights and Welfare of the Child. But I'm pretty sure that regardless of where you're based, you would have the equivalent of this. And on the right side, of course, you have the Convention on the Rights of the Child, which is over 30 years old, and which is somehow, the reference document where all the different rights of children and duties of adults are clearly spelled out. So, for example, just in relation to the theme of the conversation of today's webinar, there are some articles, some very specific articles of the Convention on the Rights of the Child, namely Article 13, 16, but also 18, which basically say the following. Children have the right not only to know about what's happening in their community, so they not only have the right to learn about events that are affecting their life and they're having an impact on their existence, but they also have the right to speak up. And adults have the duty to actually listen to them. And so when we think about evaluation and we see the evaluation as an entry point for learning more about what's working and not working in a certain aspect of community life, and when we see and we stop seeing children as beneficiaries, but rather as active contributors to the evaluation process, this is where all these articles, which seem to be a little bit legalistic, start having a little bit more sense for the work that we do. So this is the kind of legalistic argument or the right-based argument that I normally use to promote this kind of work. Then there's more factual, I guess, data-driven factor. This is what I call the demographic-based argument. So if we look at a region, any region, but let's look at my region, the Western Central Africa, for example, Africa as a whole. So recent statistics from the UN attest that over half of the population in Africa is under the age of 24. And there's a very large percentage of this population which is under the age of 18, which fits with the definition of children. So the moment where we decide not to go for engagement with children and young people in evaluation, and we keep using the same over and over adult-centric data collection methods or data collection processes, that we're pretty much dismissing and denying there's a half of our continent or half of our country's population, or if in some cases it could be probably a little bit less than half, but still a very large number of people whose interests will not be needs, will not necessarily be attended to or listened to, because there's always somebody else, the so-called adults, who are going to speak on their behalf. And right there's a huge bias. So on the one hand, we have the human rights-based approach. Then on the other hand, of course, we have a more, I guess, objective or data-driven demographic argument, which, based in our experience, has always had a huge impact on the development partners, the funding partners, and also the government representative and officials that we've been trying to have these conversations with. But now we cannot start talking about this subject without somehow placing us and placing our practice vis-a-vis the question that we are discussing now. So in order to facilitate, and this is where the more interaction part of the webinar comes in, I would like to share with you this sort of conceptual framework of reference that will allow you, but also force you to take a stand and tell yourself and tell your colleagues where your practice or evaluation practice actually and right now, nowadays, find itself in. So as you could see, we have a four quadrant of this spectrum, and the further right we go, the more child-focused and young people-focused our evaluation practice gets. So I would just try to give you a definition for each of the four quadrants, and I would like you to take the time to write in the chat where your evaluation practice belongs to, like which quadrant does it belong to. So the first one, the first type of evaluation is probably the most common types of evaluation, and it was definitely the only way to do this kind of evaluations in the past. It's the evaluation where children are mentioned in the report, but mostly as statistics. So, for example, we have demographics, health statistics, presenting how difficult or dire the situation or the living conditions of children are. But there's not really any contact. There's no real contact with children. So this is the evaluation on children, where children are basically object of research and there are statistics. Then we have the second type, which is the evaluation concerning children. The evaluation concerning children are also, quite popular, because let's say we are working on an evaluation of an education program or an education public policy. So this is the kind of evaluations where you would talk and discuss about children, but always with adults. So you would ask teachers about students' learning outcomes and about students' new attitudes, and maybe following the introduction of a new education methodology. These are the evaluations that when you would talk to the government officials, when you would talk to the school principals, but you would not talk to the children. So this is very much this kind of evaluations where are the adults, they actually speak on behalf of the children. Then we have the third quadrant, and just prepare yourself because there's going to be a follow-up comment on this specific one. So the evaluation with children, as the name itself suggests, it's an evaluation where you actually, and finally, I would say, you meet with children, you start interacting with them, you have conversations with them, you ask them questions, why not? And then we have the last, almost the ideal archetype of evaluation, which is actually the children-led evaluations. These are probably the minority of our evaluations. We do not have that many, but the ones that already took place are incredibly interesting and incredibly inspirational. These are the evaluations where there is normally a consultant who plays more of a facilitating role, but it's actually the children that come up with the questions. They actually conduct the data collection, and then they do the data analysis and eventually present and disseminate the findings of the evaluation. So going back to the third quadrant, which is the one on evaluation with children, I would like to say that in and of itself, the fact that we're working with children and that we're actually meeting with them and we're interacting with them doesn't make our evaluation a good evaluation. And let me just give you an example. I've seen evaluations that in terms of definition, they fall under the category of evaluation with children. So, because it's pretty much closer to the right side of the spectrum, we could assume that this is actually a very good type of evaluation. Well, it's not always the case because unfortunately, many of the methods that are used in evaluation with children are traditionally adult-centric methods. I'm thinking about questionnaires, I'm thinking about focus group discussions, where the research slash evaluator's agenda still prevaricates over the needs, the aspirations, of the actual feelings of those who were children and young people who are asked to participate in such activities. So we have evaluation with children, where children are forced to respond to a battery of questions that last for a year, for an hour and a half. We have a focus group discussions that last for 3 hours, where there's a pre-set agenda by the evaluator with a certain number of questions or topics that have to be discussed within a very constrained period of time without allowing the participants to actually to express themselves in kind of a fun, relaxed manner and fashion, which is the way they should be thanks to the use of data collection methods. So I can't see the chat for now, but I would appreciate if you could just mention which of the 4 quadrants, so to speak, your evaluation practice mostly resonates with, because it's always very interesting to learn about our colleagues' experience and colleagues' practice. Now, this is the sort of introductory part of the presentation. So let's now get into the nitty-gritty of the methods. And today we are going to share with you several ways, including methods, that you could use when engaging with children and young people in evaluation. And in doing this, what I will do is to present different ways of engaging for each of the phases of the evaluation process. Please get inspired. And again, these are only some of the ways we could engage. I'm sure there are many more ways where you could actually engage with children and young people. So if, with respect to the phase of the evaluation process that I'm going to present on, you see that there's an experience from your own organizations, from some other organizations that is missing and that should be, just discussed, please add a note on the chat, in the chat space, so that we could follow up with you and eventually enrich this presentation so that it reflects also other people's practices and other colleagues' practices. So the first phase is also the phase where I think a lot of learning ought yet to take place. This is basically the pre-data collection phase. This is the moment of the phase of the evaluation where you're actually planning the evaluation. You are selecting the topics of the evaluation, you are developing the questions, and you are in a sort of a pre-publications of the terms of reference phase. With respect to this very first phase of the evaluation process, we have some experiences. I decided to show them just 3 of them. We have basically 3 evaluations where youth were invited to be part of the evaluation reference group. In some cases, the youth that were being part of the reference group were there since the very beginning. So this is a very intentional, well-structured strategy that was pursued by one of our country offices. In some other cases, the youth were invited to be part of the reference group once the questions of the draft list of questions had already been prepared. So as you could see, we could have the same strategy, that is inviting children and youth and young people. Of course, you wouldn't want to have children younger than 12 or 10 in some cases being part of the reference group, because of course, it would be very difficult otherwise for somebody who was 7 or 6 to articulate their thoughts and make their, just feelings, for example, vis-a-vis of a certain question or strategy to be expressed. But it's also true that you don't just send an invitation to, let's say, the members of a youth group, and then you just tell them, come next week at 4 p.m. for a discussion with the reference group. There's some preparatory work that has to be done. In some cases, I would say in most cases, UNICEF and therefore these country offices have been working with the members of youth groups that have already had a story, so to speak, of collaboration with the country office. But at the same time, it could be that not all children or not all young people invited to be part of the reference group have prior experience with UNICEF. In any case, regardless of your maturity, so to speak, of relationship with the country office that invites you to be part of the reference group, you will always receive training on public speaking, and so there will be a consultant either from the country office or somebody was being hired on purpose for this activity that will help and assist young people to become better articulated so that their contribution to the conversations around the terms of reference and evaluations, it's not simply cosmetic or tokenistic, but that their ideas and their feelings could actually be well understood, and that their contribution is real and authentic and not filtered necessarily or partial. So this is the first phase. Again, this is the area where we collectively need to learn more about. So I was just wondering, because I don't want this to become a sort of, just a monologue for the next 45 minutes at least. I would like to hear from other colleagues. And I was just wondering if, with respect to the initial phase of the evaluation process, if you or your organizations have put in place some other strategy to engage with children and young people. So if there's somebody that would like to share their story, please do so. I can't see right now who's raising a hand or not, so please feel free to jump in. I don't know if there's anybody who would like to intervene or would like to share their contribution.
I just want to thank you. This is very interesting, but just I want to throw in this idea, question I don't have a contribution about an example.
And could you introduce yourself?
Yes, my name is Vijaya Vadivelu. I'm from the Independent Evaluation Office of UNDP. While listening to you, this is very interesting, but I was thinking in my head, why are we burdening the children to be on this advisory panel? Is it to make us look good? What is the purpose? We are able to get one child or two child or three child, right? There are questions about the representativeness of the child, which group the child is coming from. So there's so many questions. Are we relegating our responsibility of doing a better evaluation by just getting a child on the advisory panel? I'm okay a little bit with the youth, but child, I'm a little worried. And as you mentioned, it's only pertains to certain topics like education, curriculum, possibly, etc. So some thoughts, if you can fold into your presentation.
Yeah, thank you so much. Yeah, and I think that your question very much resonates also with one of the points that I tried to raise earlier. We're not doing this because we need to wash up our conscience or because it's a cute thing to do and it's a cosmetic. You use this word that, I'm always fearful of in whatever we do. So I agree with you that when it comes to children, their involvement in the limitation, just because, we've seen that their contribution could be quite limited because of the adult-centered processes where this kind of conversations take place. So the engagement of children per se of a certain age, for example, under the age of 10, is definitely not recommended. And I also appreciate the fact that you mentioned in your question that not all evaluation topics are frankly of interest to the children and to the youth. So this is why I was saying that, and also in response to your question, we don't normally have 1, 2, or 3. We have a group of, in general, we have a group of 14 or 7 children. So there's a discussion around the terms of reference and about the planning of the evaluation with a larger group of youth. And then it's 1 or 2 of them, they actually get to have the possibility to meet with the adults so that they could, those 2, become a sort of spokesperson for a larger group. Otherwise, we're talking about just the participation of 1 or 2 individuals, which doesn't make too much sense. So I agree with you. Definitely we're not doing this to make us look good or just because it's cosmetically appealing. Also, the donors, frankly, I never asked for this. So it's not that we are doing this because, some more funding is coming our way. It comes very much from the belief and, especially, I guess that one of the messages that I also wanted to send across is that you don't need to be UNICEF to do this. So, of course, your question was very much related on why you should be doing this. And, in the case of UNICEF, the response is very simple because it's on our mandate, it's our DNA. It would be very weird if we were not doing it. At the same time, I don't want to send a message that you need to have a child-focused evaluation or you need to be a child-focused organization to discuss these topics. I think it applies to everybody. At some point, I was in discussion with a colleague that was working on a large environmental project, and it was very much about infrastructure. And I tried to convince him during the conversation that just because 90% of the funding was going into the construction of schools and bridges, and didn't mean that this lens into the specific of engagement to youth and evaluation, youth and children in evaluation was not applicable. But definitely, we need to be careful about the specific age segment that we want to be including and engaging with, as part of the evaluation process. And we need to make sure that, this contribution doesn't remain as an isolated experience, because in that case, I agree with you. This could become a very tokenistic experience that will not bring much to the young people either. And so this is why we try to work with children and youth that will stay engaged, with the organization. They're already been engaged and have seen not only that demonstrate a sense of commitment to the community and the life of their peers, but will also have the possibility to act upon, let's say, some of the recommendations, or will definitely have the ears and eyes within the community, because these tend to be children and youth that are very well connected. When it comes to the equity, who are we going to invite, and how many of children's population groups are we dismissing or we're keeping away from this kind of experiences? This is definitely an area where we're trying to work on, and the country offices that have shared their experiences, they've also acknowledged that it was not possible to actually invite representatives of youth representatives for all the different groups, but because we are learning from our prior experiences, our first set of experiences, there's been a sort of ingrained attitude now that we need to spend more funding and we need to just plan a little bit better so that we could have not just at the central level, but also at the decentralized level, field office or zonal office, according to the structure of UNICEF, where we could actually engage with a larger, not just number, but also typologies of youth, depending on the particular situation where they live in or they must be more familiar with. So I hope that addressed your question. Thank you so much for your contribution. So if there's nothing, so if no other experience for colleagues, I would probably go ahead and share a little bit more on the methods, the actual methods, which means that we're delving into the data collection phase. And when we talk about engaging with youth and children in evaluation, this is probably where most people's attention has been focusing on these past few years.
This is Sabas from OSCHR. Thanks for the
Hi,
presentation.
Sabas. Yes.
Before you go into the methods, I had a doubt, curiosity.
Yes.
In the case of adults, I think it's usually easier to identify the representatives of organizations, of civil society, etc. But how do you do in the case of children to define who are the official representatives or something like that?
Yes.
Thank you.
Yes.
Over.
Okay. Thank you so much, Sawa. Yeah, I guess because of the work what we do, which is very much embedded with the reality of youth and children and youth organizations within the community, we have a mapping of organizations that are basically working on behalf of certain issues affecting a certain typologies of children and youth. So there, we have those lists. Also, we work with the Ministry of Social Affairs as well, youth, depending on the countries you go to. So you basically rely very much on existing list of recognized youth organizations. This has been the easiest way to get to those children and those youth that we're asking to be part of the reference group, because we want also this opportunity of being part of a reference group to be a learning opportunity for those individuals who could then go back to their organization and therefore share what they've learned about public speaking, about the possibility of meeting with decision makers, etc. So there's kind of a greater good on a greater social return on the engagement, for each individual that we decide to work with. And so the list of youth organizations could be easily found, just by going to organizations that are very much rooted at the community level. And they could also be obtained, although I suspected that they're not always updated. If you look, or if you just liaise with some of the agencies working on youth-related issues. I hope that addressed your question.
Yes, many thanks.
Yeah. So if you're planning to, let's say, do this in the country where you are, and you have no idea where to start from, just to contact UNICEF, contact UNFPA, contact UN Women, contact the agencies that, UNDP. Those are agencies that at the local level, the centralized level, they have been active in working with youth, regardless of whether it was an evaluation or not. And then, just go and trace back to the names of the organizations, the people running the organization, and then that could be an easy way, instead of just, cherry picking individuals based on God knows what criteria. Okay, so I hope that helps. Thank you. Is there any more question, any more contribution? Okay, if there's not, I'm sorry, I can't see the raised hand. So I will then start with the second segment or third segment, because we went first on the why are we doing this, which is absolutely not to look good, which is absolutely not to go for cosmetic or tokenistic participation. I said that the children have the right to be heard, and children have the right to actually have those rights fulfilled. And we as an adults, we have as responsible duty bearers the obligation to actually fulfill, respect, and promote those rights. And then we talked about evaluation evaluation and what could be done. There's certain dearth of experiences to this very level. The first phase of the evaluation process, the planning, right now it's mostly about engaging with children and youth, mostly coming from youth associations or established entities that do work for children, on behalf of children, and they're by themselves composed in terms of membership by young people and in a younger population, younger share the population segment in any given community. Now we're entering the third module, which is very much about the data collection phase. So we're going to look at around 10 methods. Some of these methods you're probably familiar with. Some of these methods probably you've never seen them. So what I would like you to retain from this part of the presentation is that there's so much more than questionnaires and focus group discussions. So there's so much more than focus group discussion and questionnaires, because unfortunately, when we have this kind of conversations on what methods you use, the answers in most cases is always, we did focus group discussions with youth, and we did household survey with a specific module for the youth or the young people living in the family and the households being surveyed. So please get inspired, if I may say, by at least one of these methods. And why not try to promote it more systematically? Just for you to know, we in UNICEF, at least in my region, we promote systematically the inclusion of at least 2 or 3 of these evaluation methods, to the point of being very almost prescriptive with the type of method to use, which of course entails a certain capacity development of the consultants and the contractors that get the award for undertaking the evaluation. While in the past we've been doing one-on-one capacity development sessions, including some simulations of them. Right now, we are trying to go more for a more systematized way of doing it with just offline recordings and making sure that there's actually simulation on the ground before the contractors actually go out there and do it, with children and youth in terms of implementing these methods with respect to our evaluation work. But before I start going into this evaluation method, so what I wanted to say is that sometimes some of us, it's not really the case on my team, otherwise I wouldn't be here doing this kind of presentation, but some of us, some of our colleagues are stuck with adult-centric methods. That could be questionnaires, or that could be a focus group discussion. Why are they stuck? They're stuck because their colleagues or the senior manager or the director doesn't agree with the utilization of this new, to some experimental methods. They're stuck because the donors or the entity funding the evaluation doesn't agree with the inclusion of new relatively untested methods according to their judgment and their opinion. So something that I learned recently in the course of a webinar that we organized about a month ago. We actually organized 2 webinars, one on Tuesday, one on Thursday of about a month ago. And during the second webinar, the Thursday one, there was a colleague that basically said, I would like to contribute to your webinar because we have a call for proposals, but I work with questionnaires. And so my first reaction was, oh, well, if you work with questionnaires, there's nothing really innovative about it. And he responded that he tried to actually do something a little bit more innovative without necessarily going down the route of a full-fledged child-focused or young people-focused evaluation method. And so to me, the conversations that we had in preparation of the webinar, and by the way, he made it in the end to the webinar, was very interesting, because I understood that it's a little bit too easy to tell people starting today, no more focus group discussions or no more questionnaires. I mean, it would be great, but that would be equal to dismissing the fact that sometimes we work in a very well perimeter defined spaces where there's no possibility for negotiation or for using methods that could be considered a little bit more innovative or more child focused. So this is the example of a sort of a questionnaires that he, with his team, Andrea Madri is the evaluator in this case, and he was working for an organization, I believe it was in Tanzania, and it was the evaluation of a large education program. And so what they tried to do was to add pictures and icons to otherwise what would have been a very simple, trite, business as usual survey administers to children. So I think that the important thing, or one of the important messages that I would like to convey is that looking at our existing practice, we should do something about improving that practice. And so if we are working with questionnaires or focus group discussions, there's definitely something that we could do to make even those methods more child-focused. And this is the example of our colleague that has been trying to do that. So this is kind of a premise, because I don't want you to think that I'm kind of saying that all child focus group discussions and questionnaires are banned because they're not child-focused or sufficiently child-focused. This is not the case. But, I would like to encourage all of you and your organizations to definitely go more, especially along the spectrum that we discussed at the very beginning of the presentation today. So let's look at the first on the 9 or 10 methods. The first, it's called the H framework. The H framework is probably one of the most well-known and most intuitively simplest tool to use. You ask children and young people to draw on a flip chart 2 large vertical lines, so that you could separate the flip charts in sort of 3 sections. And on the left sections, you ask the young people and the children that you're engaging with, what are the aspects of a certain projects or certain activities that have been participating in that they liked particularly, and for some reasons that they will need to explain to you. And then on the right side, as you can see from the sad face, you will try to collect basically, and to ask them to write down. If they cannot write yet, you could just write them down for them, but then you will read it aloud, and you will just make sure that what you're jotting down is actually what they meant. And then so you got the pluses and the minuses of the project, of the activity being evaluated, and in the center you have this segment which is very much about the recommendations for the future. So this is a method that is normally used when children have a direct knowledge of experience of an activity or project which they've been part of. For example, in the case of Togo, this is a real example. We used the H framework in an evaluation that was conducting in 92 schools across the country. The evaluation pertained to this program that tried to establish sort of a student council, so as we call them, students' parliaments in each school. So there was an official evaluation. When I say official, I mean that there was an adult-led evaluation. But then, we felt that it would be good on an experimental basis to actually use the H framework and see what the children would be telling us beyond the usual suspects, focus group discussion or questionnaires. And, it was very interesting because, based on the analysis of the H framework use, we identified aspects of the program that actually work and did not work, that are not necessarily come up, through traditional methods. And when we tried to reflect upon the reasons for that, we understood that it was definitely, the use of the method that made a difference, but especially, and this was the plus of using this method, of the new sort of environment or safety space and a playful space that the use of this method allowed to establish, with the children and the young people. Beyond the ritualistic use of, let's say, us as evaluators sitting in front of the children or sitting in the middle of a focus group discussion with a notebook and a pen or a computer, the whole idea of having children actually take take the markers, start drawing, start, just setting up, all these charts on the wall, and then having as part of the activity, that really depends also on the ability of the evaluator to do some little games or little energizers. That really created a sort of relaxed environment where children were not, even those who possibly had been brainwashed by the adults to say that the project had been very successful, to actually, just express themselves a little bit more freely. And this is why some weaknesses of the program came up. One of them, for example, was the fact that during the first year of establishment of this program rather, the children, the youth that had been trained to be the leaders of these parliaments were mostly last year students. So what happened is that once the year ended and the new year started, these groups had no more leaders. And so the younger ones were complaining about the fact that the way the program had been structured and planned was such that the seniors were the first ones to be trained, but also the first ones to go. And then, of course, something else that came up, but that hadn't been really coming out, through the other data collection with no use of these methods, was the unsatisfactory state of the cleanliness of the toilets, at the school. These are some anecdotal, some examples of data that we were able to collect through the H framework. Then we have body mapping. The second one, body mapping, is also with the H framework, the method that we use the most in our evaluations, including in the humanitarian settings. There's a premise. Body mapping as a method has started as a method that you would normally use with children affected by trauma. And so children that would not be able to really dig down into their intimacy to tell about some feelings are very profound or some traumas, etc. So we adapted the tool, the body mapping tool, so far from going deep down into the intimacy of a child, of young people. We're very careful in the way we administer this method, not to go beyond a point which by our training or our own limitations, we cannot normally cover with the competence that is needed. So body mapping is actually a very fun activity. As you could see on the left side, we normally ask a child, we have a volunteer, to place him or herself on a chart, on a flip chart, and then all children with markers were trying to delineate the silhouette of the person. In this case, we had already done the silhouette, so the boy that had decided to lie down, he stood up, and then at that point, all the children and taking part in the actual drawing, at that point, we start drawing the different parts of the body because the silhouette didn't have the eyes and the ears, etc. And then once that is done, and by now we should have already done a sort of game activity for about 15 minutes. So not at all a traditional evaluation or focus group discussion setting or even less questionnaires. We start asking questions in correspondence of each part of the body. So we normally use a body mapping when we want to see to what extent some changes occurred in the life of a child or a young person. Of course, you could also use body mapping with adults, but, some of our colleagues were really interested in using this method with adults, but this is very much a tool and a method that was very much developed at the beginning for engaging with children in research and also in evaluation. And so, for example, let's say that we're doing an evaluation of COVID, of the COVID-19 response, and we want to better understand what kind of impact COVID had on the life of the children. So you can look at the legs. As you could see from the picture, we have the different parts of the body in French because this specific picture was taken from drawing in a PowerPoint that we're using with some social workers in Cameroon, in the far north. So we look at the legs and we ask them, provided that you have established a sort of anchor, chronological anchor, you need to establish that something happened in the life of the community. It could be COVID, it could be an earthquake, it could be, the elections, it could be a flood. So you need to establish the kind of anchoring on the point in time, which will allow you to determine the before and after. And I think that is something that you could identify at the very beginning of the activity. In general, you would discuss also, that before and after before you arrive, to the field, because this is kind of information that you should be having already. And you ask children, compared to, before COVID, let's say, or before the flood, are there places today that you could no longer go? Or you could also ask the questions, are there places where you couldn't go earlier before COVID, but you can go to today? So starting from this parts of the body question, you start in sort of digging down the experience and the lived experiences of children, which very likely would happen with the less facility if you were using a focus group discussion. Remember, all of this, it's a game for the children. They are not thinking, they almost forgot that they're actually being part of an evaluation activity, because the posture of the facilitator, of the consultant, of the evaluator is very different. They're not sitting on a chair, they're moving all the time, they're playing with the markers, they're very free to express themselves and let us know what they think and what their experience is with respect to the different parts of the body. So the head is very much about knowledge, about things that they know, about things that they understood. Ears is about the things that they hear adults say, or hear children say, or hear things that the children or adults are no longer saying with respect to, for example, the beginning of the pandemic. The heart is a little bit more difficult because sometimes this opens a Pandora box, so you may want to be very careful, because in French, so the heart is very much about the feeling, about how you feel about certain things, what are the things that you love, etc. Of course, it's the children that tell you what each part of the body stands for. You could steer the conversation in a certain direction just to open up a little bit more the definition, but you don't come from home with the definition of each parts of the body. And you, although you have a certain questions, of course, you understand the logic of this exercise, you don't come with a pre-packaged list of questions to ask, because you have to be very careful that you cover, of course, the purpose of the evaluation, and therefore that you respond to as many questions as you can. But at the same time, you have to be careful to just embed yourself in the activity with the children, use their own terminology, and just go with the flow, instead of breaking it with your battery of questions in less than an hour. Of course, to do body mapping, more than in the case of H framework, you need a little bit more time. So body mapping would normally take about 2 hours, 2.5 hours, provided that you want to organize some energizer or some other even more playful activity, either before or towards the end of the activity itself. Then we have a third method, the Smiley scale. The Smiley scale, we all know, even when we go sometimes to airports, so just right after the passport control, they ask us how happy or not so happy we are with respect to a certain service. In this case, we try to use it, and of course there are some other organizations that are doing it too. And so what we try to do is just to look, for example, at a specific program, and for each of the components of the program or some specific activities of the program, to give those components a different column, and then in correspondence of each activity, identify different possibilities of smiley appreciation or level of appreciation. Each smiley, of course, has a number, as a score, 1, 2, 3, 4, 5, 1 being very unsatisfied and 5 being very happy. And then you basically ask each child in a group, or normally, 10 or 12, it depends on what kind of, the specifics of the activity that you're running. Of course, you want to do it in multiple groups, and not just rest on one group only. And then you ask boys and girls to actually provide their score, to assign a score to each of the activities or dimensions of the program being evaluated. Then you draw the sum, and then you divide it by the number of participants, in this case 10, and this was a sort of quantification of otherwise qualitatively collected information. And as you could see from the last row, it seemed very much that children in general were not very happy with the very last activity on the far right side, and they were particularly happy with the one with the highest mean of a 4.3. Something I forgot to mention with respect to body mapping is that unlike the Smiley scale, where you could have boys and girls together, in the case of body mapping, what you want to make sure is to actually have two separate groups, so one with boys and one with girls. So you would have, for example, a group of 6 to 8 boys and a group of 6 to 8 girls, separately. The reason for that is that, especially when it comes to telling lived experiences, it's always very important to give boys and girls a separate safe space to discuss. Remember, some of these methods also allow children to tell us things that sometimes go beyond the actual parts of the body of the silhouette. So we want to make sure that whatever we hear that is not directly applicable to the evaluation, we need to be very careful not to go into the digging too much of certain aspects of intimacy of a child, because we are not in most cases qualified to do that, and we could do more harm than anything else. And we need eventually, provided that we see the risk or a possible harm, let's say if a child tells us about violence in the household, and despite the confidentiality, of course, that we try to establish, there must be a way for the person doing body mapping to discuss, for example, with the social worker or the people within the community. They have the responsibility for following up on very specific cases. So we never do body mapping in general, as unlike age framework, or we don't never do photo voice without having established already contacts with social workers or NGO workers or individuals and professionals at the community level who could help, or assist a child, or in case of certain things being said during this work, there needs to be a little bit further discussion and follow up. Then we have the impact drawings. This is very simple, and again, this is where you could, for example, ask children and young people at the margin of a focus group discussion, provided that you decide to work with a focus group discussion or with some other of the methods that I already explained. You could ask them to take, for example, 20-30 minutes to actually do a drawing of the before and after. In this very case, this is the story of the case of the drawing of a kid, a boy, that was basically telling us, before I joined this project, which is very much about empowerment and about, understanding a little bit more, how to voice my concerns and my fears and how to overcome them, I felt like I was tied to a tree and I was completely mobilized. But, after being in this program for almost a year, I feel more powerful. I guess it was the kid's way to tell us what empowerment for him was all about in that very specific case. And for those of you that work on empowerment issues, you probably have very good quality tested instruments with many different questions. So again, I'm not saying that this would replace those tools that you may be using, let's say, to measure empowerment amongst young people and children, but it's definitely a complementary way, and a way to triangulate why not, to make go a little bit more in depth with specifics to some other issues that may come up, or feelings or thoughts that may come up during traditional interviews. Then we have the child community mapping. So as you know, community mapping is not in and of itself a child-focused method. But the child community mapping is basically something and a method that we normally use. I personally used it very much in areas, in border areas. So for example, when we know of jihadist attacks in the vicinity of the border, and we are working with children in humanitarian situations, this is a very good tool. To learn more about the community dynamics, so where children could go, could not go, where they feel safe, where they feel that it's not very safe, where there are bad people, so to speak, within the community, and what is so bad about what they're doing, and where the people that they could trust and they go to in case of needs. So the community mapping could also be considered sort of mobility mapping. It serves different purposes. But what I like very much about the community mapping is that, as you could see from this drawing, we're very careful about delineating the square or the perimeter, because it's the moment where you delineate the perimeter of the community that you could start asking questions about what's happening outside of the community, what's happening on the other side of the border. And I guess that because this is a very sensitive issue, and this is an issue, for example, where you have, and I'm quoting here, bad people coming from the other side of the border to kill people in our community. It's very difficult through a focus group discussion or through a questionnaire to actually get to the type of information and get more from children than just phrases or words that they have passively listened from the adults who have probably been very adamant of saying that there are bad people coming from the outside and they come to the community to kill all of us. So through this community mapping, the first part was very much about, let's start from the places that you go to. Let's play from the what are the most important sites of the community and why that is important. Also, we looked at the danger, and there are several dangerous places. One was the river, which was very close to the community. There's another area where there are strange people doing rituals, and you have to be careful as a child, to get close, because apparently there's been abductions of children also for ritualistic purposes. Then also there are places where children unfortunately do not go to school and they travel all day, work all day in the field. So you understand a lot about the community dynamics. But then the time comes when you start asking about what's beyond the border, and this is where you learn a little bit more about children coming from outside the border. They're coming to the community and they're not very well accepted, because exactly everybody thinks that these children and their parents are all bad, evil, and they try to kill all the community members. So there's a lot of possibility for opening up a discussion on social cohesion, and in that very specific evaluation, the social cohesion component of the strategy of the program that was being evaluated was very weak. So definitely one of the key recommendations was that there was a lot of work that needed to be done on the social cohesion aspects, especially of those individuals or affected populations that migrated from their country to arrive in a new one, hoping to start a new life. Then we have the snail. The snail is a method that you use with younger children, definitely under the age of 10. It would be otherwise very offensive to an adolescent to use this kind of method. And I guess that we have to be very careful about the age appropriateness of all the methods that we use, just to make sure that the adolescents will not just refuse to take part in the activity because they consider it a little bit too childish. So speaking of empowerment, or speaking about level of fulfillment or level of self-realization, this is a method that we could use to ask children about how they feel with respect to a particular situation or a particular skill. So for example, if they feel that one of their skills or one of their ability to do, for example, speak in public, or to voice their concerns, or go to find someone in the community and ask for help in case of need, they will tell you that they feel like the snail on the right side, far right side, when they're completely happy and and they feel they completely developed a particular ability, or they would just tell you, listen, I still have to work on that specific ability. I don't feel very empowered with respect to this. And this is where they would say that they still feel as a snail that hasn't come out of its shell yet. Then we have a river of life. The river of life is a method that allows you to talk about the difficulties, the challenges, but also, the achievements of somebody's life or somebody's participation in any given program, etc., using the metaphor of a river. A river, of course, is like a flow. So the river is the life of those, in the groups that we engage with, who will tell us more about their own experiences. There will be rocks along the flow that will block the flow of the river, and this is very much the challenges that children and young people have faced in their life. But there will also be some positive forces. So for example, there's going to be emissaries, other small flows that will bring water into the main flow, and they will bring more water, and it will just add more strength to the actual flow. So the river of love, the river of life, is then a possibility for participants to really tell us, some changes that happen in their life, but also what those factors that either enable those changes or prevented those changes were. Then we have a photo voice. I believe the photo voice is actually the last of the method that I'm presenting today. Photo voice, is one of my favorite methods, and we used it in several countries, and more lately I used this method in southwest and northwest Cameroon, the region of Cameroon, the English-speaking part of Cameroon, where, as you probably are aware, there's been some turmoil and some humanitarian crisis over the last 3-4 years. So photo voice basically is very much about the use of pictures and photography to visualize the social landscape. So it could be positive or negative aspects of community life. But it's not just about taking pictures. It's also about reflecting on the meaning of those pictures collectively, and then eventually have some key messages for policymakers or community leaders, so that they could act upon the information that is being conveyed through the pictures. Of course, photo voice is very much an ideal method to use with children and young people that are not as good maybe at expressing themselves, because maybe they didn't necessarily go to school. They're not used to articulating their thoughts as well as other kids are probably in school, and they're a little bit more used to exposing and recounting their experiences in front of other kids. So there are several steps to the photo voice process. First, in general, a photo voice process lasts for about 2.5, 3 days max, which means in and of itself it is quite an investment. So the first 3/4 of a day, or maybe the first half of the day, is very much about building trust and confidence with the children, which means that you don't get to go into, let's say, the exercise itself or taking pictures for the sake of an evaluation right away. You have to play games, you have to explain to them about a camera works, etc. So it's very much about different activities than what we normally do in evaluation, where we end up doing sometimes 2 or 3 focus group discussion in one day. So let's think in 3 days we could do almost 8 or 9 focus group discussions. In this case, we're just doing I'm just using on purpose to say just, but we would see why it's not so just in the end. We're doing photo voice with 12 children, 6 females and 6 males, some in school and some out of school. Then phase 2 is after they learn about how the camera works, so they go out in the community and they start practice their camera. Each individual child get a camera. Cameras will be returned, at the end of activity, at the end of each day. And they go out for a couple of hours, sometimes less, they have less time, to take a picture of somebody, something they love or they like particularly, something they don't like in the community, take a picture of somebody they don't know, and then take a picture of something that moves. With respect to the third topic or subject of the picture, somebody they don't know, we first of all always have adults following children from a distance. It's understood that the perimeter of action and walking around for the activity is not too vast. So we always try to, make sure that in the community, everybody has been informed about the activity beforehand so that there's no surprise in seeing children going around with cameras. B, we try to conduct the activity in a place where there's no military presence, there's no risk of any attack, etc. So we're not doing photo voice at the border, let's say, or in areas that we know could be conducive to or could raise too much attention about this activity. And the third topic of the subject for the picture, taking a picture of somebody you don't know, is also a way for us to, provided all the adults in the community have been informed by this activity, is for children to practice the consent. You cannot take a picture of anyone without having received a consent, a written consent. So normally they would have a slip of paper that says I, and then we leave the space, consent the child as part of this activity to take a picture of me, and then they need to put a sort of signature or an X and a date. Okay, and the picture will not be used. This first set of pictures is very much for internal uses, so it will not be publicly showcased. But it's important that children understand just as much as adult photographers should be doing. Every time you take a picture, they need to understand the importance of the consent. Phase 3. We use a body mapping in this very case, and in some other cases, we use the body mapping and community mapping to identify the subjects to photograph. So once the children have understood how the camera works, and I wanted to show you that we have also portable printers. Normally for a group of 12, you need 3 printers. So they will now decide what real topics they will use for the work, for the photo voice evaluation. So we will have conversations about, starting from body mapping, about the changes or some of the events that will somehow be part of the evaluation. And then the conversation will lead each of the kids in a different direction. Each child will decide to take about 4 or 5 pictures. They will probably take 20, 25, but they will only print or develop 4 or 5 because we also make them understand that there's a cost in developing. And interestingly enough, all children will be able to keep the pictures they take. The night before the presentation, the public presentation, we will ask a local photographer to develop A4 size pictures, but the actual smaller pictures, they stay with the kids. The big pictures stay with the school or with the organization or with the local authorities so that they could recycle them and use them, for some other educational activities. So then the phase 4, which is actually the field work, picture taking. Then we have the photo elicitation and the transcription of messages. In order for children to communicate with decision makers, there needs to be, first of all, a selection of pictures to show, and also some messages. What are the messages? So you cannot probably see it, but I'm sitting down with my computer and I'm basically listening to what the children are saying about each individual picture. I'm not changing the text. I'm not adding my wording. It's very important that what I transcribe, provided it is clearly sufficiently clear enough, that comes directly from children. So if I think that the message is not clear, then I ask questions. But what I'm doing here is I'm very much a transcriber of what the children are telling me. And then the last one is the presentation back to the community. So we will have a day where this presentation will take place on day 3. The children are in charge of the agenda. They're in charge of deciding how to structure the half a day. And in general, who to invite? Well, of course, the teachers, the social workers, the parents, but also, and this is the most important thing, the local authorities. It could be the regional director of development. It could be the mayors, not just, the parents or somebody in the community that lives in the proximity of where the activity took place, because it's part of the methodology that whatever comes out of the pictures, especially in terms of injustice or areas to improve, etc., that the decision makers, the policy makers will be made aware of them so that they could take some actions. And so UNICEF is now working with the same group of kids over time to make sure there was going to be some just follow-up photo voice sessions. And the dialogue of the community was very interesting because, yes, the children are presenting with the microphones, but then it's the rest of the community that engages and asks questions to better understand what these questions are all about. So we have a video here, and I would like to show it to you. So this is just a video of the work that we have done in Togo, northern Togo, at the border with Burkina Faso. So the presentation was in French. I hope you could see it, but the final message was very much about all children have the right to tell us what they think and about whatever happens in the life community, and they have the right to express themselves. And as I said at the very beginning, adults have the obligation and the duty to listen to them. So I will just go quickly some of the lessons learned. I will not go through each of them. There's been several lessons learned from the photo voice activity amongst the colleagues who were in the planning, sectorial programs, and also my own lessons learned. I guess that what we noticed and what we observed is that this kind of methods, especially photo voice, allow children to finally exchange freely, putting the researchers and evaluators agenda a little bit back in the back seat. We were able to work with both in school and out of school children within the same group, which is quite interesting because in general, when you have a focus group discussion, you tend to work with the most articulated ones, the most brilliant students in some cases, which is not the case. And so through this activity, we made children coming from different paths of life come together and actually learn about their own universes, because in school and out of school children within the same community do not always talk to each other, do not always frequent the same sites, etc. And the children really highlighted their priorities, some of which were not part at all of the evaluation agenda. We expanded on so many other issues, speaking about qualitative methods and speaking about exploratory purposes of the method that we use. Photo voice, as you could probably see by the type of investment and the time that we spent with children, it's not just a method, it's an intervention in and of itself. Of course, there are some cost implications, so there are some time implications, but it's also true that what we get out of these methods, especially when it comes to engaging with children and youth, seems to be deeper and more authentic than what we would be able to get otherwise through other methods. The person who facilitates photo voice, who facilitates this kind of methods, is definitely very important. You don't become a photo voice facilitator after having received a training, because something that I didn't mention is that as part of this program, or as part of this evaluation, we also trained 6 facilitators, photo voice facilitators, so that they could then become facilitators themselves, trainers of trainers. And there was an image where I was at the local university in Kara in central Togo, where I was pretty much teaching this method also to a large number of teachers and also students. The community presentation, so the last day, becomes a political act. This is where we create the bridge between the evaluation and the decision makers, between what the children wanted us to hear as adults and what the other adults, probably more important than us evaluators, that is the policymaker and the decision makers, to know. Of course, there's an attention span, just like adults, which in this case, engaging with children and youth becomes more apparent. You have to take breaks continuously. You have to be fun, you have to be engaging. As soon as you see that the attention level is decreasing, you really have to stop and, be very resourceful. And of course, also tap into the resources that the children themselves have. For the data analysis phase, I wanted to share an experience of Plan UK, where they basically did an analysis of the data collected by children, because this was a child-led evaluation. And so in order for them to assign a value judgment to each of the activity implemented as part of the project, they used a certain rubric, and the rubric basically for each level of implementation or satisfaction was always associated with an image of an animal. So we have the lowest level was a lizard, then a goose, then a deer, then a cheetah, and the highest level of performance was that of a cow. And so if you could see in the very end, for each of the criteria used, they had a certain level of performance, so they have a certain level of performance of the program itself against each of the criteria. And if you look at the meaning of the different parts, this is pretty much an image that kind of resumes the evaluation. You have the head of a cow, which means that the planning, actually the intervention according to the children, was actually very good. And then depending on the legend of the different parts of the body and what each parts of the body corresponding to which animal, you could understand also the level of performance against the criteria. These are some other ways of analyzing the data with children. Once we just go over the data collected together, etc., we try to test the temperature and to say how high the temperature, how high on a scale from 1 to 5 was the performance of the program with respect to relevance, effectiveness, sustainability, equity, and gender. The dissemination phase, we won't have too much time for this now. There's been some very interesting experiences shared by our South African colleague, Madhu James from Rensburg. She's an independent consultant, and she's been working very much in South Africa and also other countries of the region in not just doing child-focused evaluation, but making sure that whatever comes out of evaluation is disseminable according to the children's taste, interest, and needs. And these are some of the key resources in case you will be more interested in learning about how to make your evaluation materials more child-focused and more child-relevant. Then, of course, there are some other ways, and this is an example of Malawi, UNICEF, where traditional dances and other artistic activities were being used to disseminate the conclusions and recommendations of an evaluation. And then in terms of ethics, something that we learned, and that we make sure through the through all the use of these methods, the compliance with ethical guidelines is very much, ensured. We all try to go through a fast track ethical clearance, with a firm that has an exclusivity contract with UNICEF, so that whatever we do in terms of engaging with youth evaluation is pre-vetted. Of course, there are some principles that you would normally apply in any evaluation with adults, but working with children, we have the sense of even greater responsibility. And I think this is a very important aspect of any work that we do in engaging with children and youth. And then the conclusions, I guess, what I wanted you to retain from this is that there's a possibility for us to engage more intentionally, not just because it's an evaluation with some children in it, as focus group discussion, let's say, or questionnaires that were being child focused. So we need to think about the spectrum that we showed at the beginning and see how we can move to the right. So in order to do that, we need to go beyond the usual suspect methods. We're not saying that those usual suspect methods are not good, as I also clearly said in one of my slides, but there are definitely more methods that we should explore and use. They're in compliance with the ethical guidelines as being already stated. In UNICEF, we have the ERIC, the Ethical Research Involving Children website, that really helps us in all the different phases of research and evaluation processes. And of course, it takes time to do this. So we need to invest, and an investment will pay off because it will provide us with more authentic data, with deeper data that will let us know a little bit more about the context where the children live and where the programs or policies being evaluated operate. Also, the children's world is very diverse. So the fact that we are working with 12 children doesn't mean that we're capturing everybody's voice. We have children with disability. We have children in school. We have children out of school. We have children who have been victims of rape. We have children living in conflict settings. So we need to be very, very careful in selecting the children that we go with, that whatever comes out of our evaluation, that we don't ascribe, so to speak, whatever came out of our work, saying, okay, well, all children in the community told us or made us understand this, and this. We need to very much qualify our statements and make sure that whatever inferences we make about what we have seen and what we heard with respect to our program and our public policy, we have an external validity that is very much better defined and well defined. So we don't have the time to go over these two videos, unless for those that would like to stay further. Just a second. But this was pretty much the last slide of our presentation, and I would like to thank you very much for the time that you've been spending listening to me. And I know that we have a very little time for any exchange or question and answers, but I would be very happy if you could write your questions in the chat. I will be happy to even respond them, at the end of the webinar. And for those who would like to stay a little bit longer, please, do so, and I will be happy to respond in person. So you asked a question: should this be done only for child-focused projects and programs, or most projects that ultimately affect children? A project support? Yes. So Gordon, I believe that I don't know if you were here since the very beginning, but this is exactly one of the key messages that we would like to convey through the presentation. This is not just about UNICEF evaluations or evaluation of child-focused projects, because youth and young people and children make up for almost half of the population in many of the countries that we work in. It's an act of responsibility to let those voices come up and be duly expressed and promoted within the course of evaluation. So absolutely, the word child doesn't have to figure in the title of any project that we evaluate in order for us to use this kind of methods. If there's no more questions, maybe what we could do, just for those who would like to stay, I have two 3D animations of 2.5 minutes each. In any case, I would like to thank UNEG for this opportunity. Please stay in touch. We are, very much focused on, on child-focused evaluation through LinkedIn or Twitter. We have a page on the Evaluation Office website in New York on this. And next time, it would be great to also have more UN agencies sharing their stories. I'm sure that, there's a wealth of experience. Unfortunately, for the sake of this webinar, we were not able with some other agencies to come up with a 3-agency presentation. But I think, and I hope that maybe you got inspiration from the presentation today to use more and more. So I will show you the videos, and in the meantime, what I would like to find out from you is that based on the presentation today, do you feel that you would be using some of these child-focused methods? And if so, what is the method or the methods that you like the most, or that you think it would be most appropriate for you to use? So while I show the presentation, it would be great if you could also just write in the chat what are the methods that you think would be good for your agency to use in the near future. The first video on engaging with children in evaluation. So this was very much a video that we used with donors in mind and commissioners in mind. I understand that this scenario is probably exaggerated, because you will not probably find a 6 or 7 year old kid getting access to the Ministry of Education, but there's a lot of metaphors. The moment where she pulls down the handle is the moment where the children are finally accessing the place of power. So we designed every single segment of this 3D animation with a lot of accuracy and with a lot of intentionality. And we are using this with donors, with commissioners, with people who have the power to commission evaluation and make their planning processes definitely more inclusive. The second one is more about how to make your evaluation more child-focused during the field data collection. So it's very much about 2 different scenarios. One scenario with good evaluators, they are child-focused evaluators, and another scenario where the evaluators are not, very child-focused and they're quite bad. And so we try to also engage the audience around this video to reflect, this could be students, it could be evaluators themselves, about how to make their practice a little bit more child-focused. Here you go. Okay, so I hope for those who decided to stay that you did not regret the fact that you stayed a little bit longer, and I hope that these videos were of your interest. So again, we exceeded the time that we had allotted for this by 10 minutes. So I see that Stephanie was very much interested in photo voice. Great. So for those of you that uh, are thinking of using some of these methods more systematically in the future, please reach out to us. Again, this is a sort of movement that we are creating, and we're pushing so far, for this, so much for this, and we had great responses from many of our colleagues colleagues from across the region. We're developing also a global guidance note on this. So there's a lot of interest and there's a great momentum. So it would be great if this were as a UNEG initiative, like a multi-partner effort. I know that we have some agencies, UNFPA, UN Women, we're very much working, of course, with adolescents and girls, UNDP also, etc. So each of us has a responsibility, I guess, to be part of this of this conversation. So very happy to receive your contribution. It's also to learn more from you, because I didn't want either to give the impression that we are the leaders in this discussion and the UNICEF has more experience. Not at all. It's just that we have the time to put all this together. We've been thinking about this and we're investing time and energy, but I'm sure that there's many beautiful experiences out there which we're not yet aware of. So it would be good if we could give a little bit more visibility to this. Maybe there could be a second follow-up webinar. In this case, it would be some other agencies showing and sharing their experiences. So again, if you are interested in conversing this topic further, do not hesitate to contact us, and we will be sharing the presentation, also the key resources, shortly. So count on that, and let's keep the conversations alive, and let's try to promote this, child-focused and young people-focused evaluation more systematically and intentionally with not just our colleagues at the office, but also our in-country partners, our funding partners, because we need also, some investments for some of these activities and methods to be used more systematically on a wider scale. With that, I would like to thank you so much for your attention, your fidelity, and your interest in the issue. And as I said, let's keep the conversation going. Have a really good continuation of your day, afternoon, or evening, depending on where you're locally currently based. Thanks so much for your attention. Bye-bye.